Hey, good afternoon and welcome. Thank you for joining us today. I'm very happy to be with you here today for what I hope will be a very brief time. We won't spend a lot of time today, but I wanted to take this opportunity just to say happy holidays to you. We're certainly glad to have all of you who are involved in public health. I can't think of a better privilege that anyone could have than to work for public health. Taking care of people's health is the most important duty and responsibility that I've ever enjoyed, and I really appreciate the opportunity to be here with all of you who feel the same way, I think, in most cases, and we have a chance to accomplish many great and good things. So thank you so much for being here today. I just want to take a few minutes to go over just a few things that we discussed earlier today in our central office meeting and our meeting that we just finished with the district administrators. I wanted to let you know about a couple of different projects that we've been working on here at the central office that will affect a lot of you statewide. Perhaps the most time-consuming thing that we've dealt with lately has been our opioid council. You may remember that the governor constituted an opioid council back in the summer, and we've been working very hard the past few months to put together a strategic plan that's due by the end of the year to try to help Alabama overcome this scourge of opioid addiction and abuse that's happening not only in Alabama but throughout the state, throughout the country. Alabama continues to see increasing numbers of opioid deaths. We found that this is a very challenging problem to get around. It affects people in so many ways. It affects not only individuals who are using substances in an unhealthy way, but also affects their families. It affects marriages and children. It relates to our schools. It relates to our prisons. It relates to so many social institutions. It's a tremendous problem, and we're doing our best to try to come up with ways to deal with that. So in terms of ADPH, we're doing a lot of work with our prescription drug monitoring program to make it easier for prescribers and pharmacies to identify people who may be abusing drugs. We're working with law enforcement. We're working with folks who are trying to distribute naloxone, which is the opioid overdose reversal agent. And we're working with mental health in trying to find ways to help people obtain access to mental health care, to substance abuse treatment, and to get help when they need it. So it's been a big project. The strategic plan is sort of drawing to an end in the next few weeks, but we know that the work's going to continue for quite some time. I wanted to mention to you also that you may remember that we just released infant mortality data last month to the State Committee for Public Health. This is a big project that Vital Statistics works on throughout the year, so this is our 2016 data that was just released this past month. Unfortunately, we see that infant mortality in Alabama still continues to be a problem. Our numbers are not good. Our numbers have not been good for quite some time, and even when we see years when we make improvement, we still lag behind many parts of the country in how we do with infant mortality. Particularly, there's a racial disparity in infant mortality. Our rates for white Alabamians are still worse than those nationally, but the rates for African American Alabamians are much worse than that. And so we've tried to find different ways to approach this. I would say one thing that's come out of this that might be considered fortunate is that our governor has really taken notice of this problem and has indicated that she's very interested in trying to find resources to help us provide some solutions to this. So the Children's Cabinet that she has called is going to be meeting in the next 2 or 3 weeks. Sometime before Christmas. We're planning to present all of our infant mortality data at that time and sort of explain what ADPH is doing to try to intervene and help with that through our perinatal coordinators and through other programs in family health services and in some other bureaus as well. So hopefully we at least have the interests of the people who matter and who are maybe able to allocate resources to us so that we can begin to deal with this problem. I also wanted to let you know today that you should be expecting to hear an announcement on our new state laboratory in the next few days. We're very close to closing a deal for where we will build this and how it's going to be financed and taken care of. We're really in the final stages of negotiations, and I think by this time next week there'll be a public announcement about that. We know that our laboratory staff works very hard in some pretty challenging conditions. The current state laboratory building was built in the 1970s and is really in need of repair. In fact, probably can't be repaired. So they've stuck together under hard conditions, and we're looking forward to trying to provide a new facility for them. And so stay tuned for that news, and it should be coming out in the next week or so. Finally, I wanted to say I think it's a good time to remember our colleague Glennis Rush, who you may know had passed away just last week. Many of you have known her very well, and almost all of you have probably worked with her at one time or another. That was very unexpected. It's been a particular tragedy for those in HR who worked with her closely, but many of us knew her to some degree, and so this is a time as the holidays approach when we know that her family will be hurting, when they'll be wondering what's going on, when they need support and they need people to reach out to them and show that they care about them. It's always difficult when you have an unexpected passing to know what to make of that, but it's even worse when it comes to this time of year. So I want to also reiterate something we talked about this morning. Even though the holidays are here and these are happy times and we all have plans for doing things that are lots of fun, remember these aren't fun times for everybody. There are people that struggle with loss in their life or with personal tragedy, people that have to deal with depression or deal with other issues. And so when you're having a good time and when you're enjoying the holidays, just remember to reach out to those folks around you who may not feel the same way that you do. We certainly know that those folks are around us. They're our friends and families and coworkers, and this is a good time of year to remember that. So that's really all I had to talk to you about today. We appreciate you joining us. I know it's a very short message, but the main message is to say thank you for all you're doing and happy holidays to everyone.